Welcome back to Passionate World Talk Radio. Educate, enlighten, entertain. And this afternoon, our special guest is Dr. Deane Waldman, who wrote a book called Curing the Cancer. So good afternoon, Deane. How are you doing?
I'm doing well, but you got to say curing the cancer in U.S. healthcare. It's not just cancer in biologic people. It is that our system, our healthcare system, literally has a cancer, a malignancy, and so the purpose of the book was actually to help people cure it and cure the cancer in healthcare and get the care they need at a price that they can afford. Anyway, how are you?
I'm fine. I'm glad you explained that because I would have explained it, but I think it started when the PPO came in and the HMOs.
Actually, a lot earlier than that. The whole system started to fall apart when one key thing happened, and that was, this is back in the 1930s, when third-party payers, insurance companies, instead of being insurance, became a prepayment system and separated the doctor from the patient. That separation is actually one of the two root causes of why our healthcare system doesn't work. If you think about it for a second, in anything else you do in life, in any other commercial activity, whether it's going to the store and buying a sweater or getting a lawyer to write up a contract, whatever it is, the buyer, who is the consumer also, pays the seller, and the seller provides a service to the provider. Now you can get into all sorts of details of the financing, but the bottom line is that they are connected directly one to the other, buyer and seller, and that's a free market where the seller sets his own prices, and if the consumer doesn't like the price, he doesn't go to that seller. He goes to another seller. The sellers have to compete with each other, which is what drives prices down, and that's how, you buy a sweater or a car or get a contract made up by a lawyer. You choose the lawyer. Well, in healthcare, it's the third party that takes your money and then spends it for you how they want, not how you want. Meanwhile, the sellers, namely doctors and hospitals, simply live under a fixed payment system, fixed literally by the federal government. So it doesn't matter what I charge to take care of a baby with a hole in his heart, and I take care of babies with heart disease. It doesn't matter what I charge because most of my patients are Medicaid, which means they're government supported, and I either accept what the government says they're going to pay me or I don't. But I can't make any more money. I simply have to say, okay, I'm the seller. The buyer is literally the government, not the patient, and that is the reason that our healthcare system is falling apart. Prices keep going up because there's no pressure to drive the prices down, competition among sellers. And meanwhile, everybody's spending OPM, other people's money. So you're not taking money out of your pocket to pay the doctor or the hospital, and we need to reverse that. And the last thing I'll say, and then you can chime in here with any questions or thoughts, is I've heard many people, when I say we need to reconnect doctor and patient, they say, oh, well, I can't possibly afford to pay for, my hospitalization for my knee replacement, or I know that you, Lillian, have to take expensive drugs, and it's like, well, I can't afford those drugs right out of my pocket because they're very, very expensive. I know something about this because our head nurse has another condition that is very expensive. The drugs, they're very effective, but they're very expensive. Anyway, the average American family in 2018, the average American family spent $28,166 on health care costs, most of which went to insurance premiums. And I turn around and look at that number, $28,000, and I say, suppose instead of giving it to the insurance companies, they just stuck it in an HSA. And they went and shopped for their care. They went to one doctor for, the knee replacement. He said, oh, yeah, I've done 10 of these, and it's going to cost you $15,000. Another guy says, oh, I've done 150 of these, and it's going to cost you 6 or 8 or 10 or whatever. Because in a free market system, and we do have a small number of free market practices in this country, both surgical and medical, the prices are fantastically lower than what the insurance companies both charge and pay. So I'd like to see people control their own money.
I think it's a great idea, because if the doctors and the pharmaceutical companies don't get you, it's the hospital bill where they nickel and dime you to the point where something like that 40 years ago was half the price.
Oh, I'll tell you something fun. You'll enjoy this. My mother-in-law, I'm one of these very rare people who loved his mother-in-law. I mean, she was the neatest person in the world. Anyway, she died a few years ago, and my wife and her brother and sister were up in the attic, sorting things in preparation for selling the house and so forth. She found, my wife, who was 73, found her hospital bill from when she was born in 1946, okay?
Yep.
You ready?
Yes.
$19.50.
Yeah. Yeah, well, that wouldn't even buy you a cup of coffee in the hospital.
And that would not buy you a lunch or a cup of coffee you could probably get, but you certainly couldn't get, IV tubing or a breath pump or anything for that. And that's what the hospital bill was. And by the way, I think the doctor's bill, and I don't remember, it was something like $40 or $50.
Yes, I remember back in the 50s, our primary doctor, when we went in to see him, was only $35.
Yep. Well, right now, right now we're talking about direct primary care, which is a doctor who gets paid by a patient, and it's a membership kind of thing. And there are these practices, and they're exploding around the country. The average cost for a patient, say you, an adult, is $100, $75 to $100 a month. So that's $1,200 a year, and you'll see your doctor as often or as infrequently as you want. There are no additional charges to go in and, check your knee, or, you're having some abdominal pain or diarrhea or whatever your symptom is. You call up your doctor, and within 24 to 48 hours, you're in the doctor's office, and he's not or she's not rushing you because, they've got to spend, we doctors have to work under what's called benchmarks, which means that you're supposed to see X number of patients in a day.
Yes, I know all about those.
Okay, well, if you think about it for a second as a patient.
Oh, I do. For the amount of money I need to pay him.
Well, what happens is you got to rush the patient through.
Yes.
I'm talking from my standpoint. Because, for example, for me, I'm supposed to see 4.2 established patients an hour. Okay, that's the benchmark that pediatric cardiologists are supposed to have. So
it's 15 minutes, isn't it, for a visit?
14 minutes per patient.
Yeah, exactly.
And as I say to a lot of people, hell, the first thing I do when I go into an exam room with a mother and a child, a 2-year-old or an 18-month-old or a 4-year-old for that matter, is I usually get on the floor and play with a child so that the child feels comfortable with me so that I can examine him. I mean, forget everything else. Forget the history and, reviewing medical records and stuff like that. I need to examine this child, and the child is fearful.
Yes, not to mention what the mother or the father is doing.
Yeah, so I've got to, so it was a joke. I just, because I was the chief of cardiology at the University of Chicago, I basically had the authority to say to the financial people, no, I'm not going to live by your benchmarks. Well, you have to. No, I don't. I've got tenure. You can't fire me. So, go, climb
blow it
the
out
rope.
your nose.
And so, I mean, it takes me when I'm with a patient, most of the families of my children tend to be young,
they're in their 20s.
Yeah, usually in their 20s or occasionally 30s. Well, these are people that don't know a lot about congenital heart disease. Even you, Lillian, I doubt knows much about Why would you know anything about?
Oh, well, my husband had a double bypass. And
but that's adult.
That's true. That's true. He was an adult. And lots of people in my family have had heart problems. But you're right. They were all adults.
So the point is, I've got to sit there with this young couple or young mother, whatever, and draw pictures and explain, well, here's what a normal heart looks like. Your baby's got a hole right here in this wall, and we're going to need to close that hole. And the reason that the hole is a problem is that the blood's going the wrong way, and all this kind of stuff.
And it's really overwhelming and scary.
Am I going to do that in 14 minutes along with examining the child, looking at medical records, and using the electronic prescription? It takes an average. I actually did a time motion study. It takes an average of 11 minutes to complete an electronic prescription. You got to go through a whole bunch of screens.
I know. Yeah.
Okay? Well,
yep.
Now you got 11 of my 14 minutes are gone just trying to write a prescription for digoxin or for blood pressure medication. I mean, my goodness. So my point is, back to this. If we had direct connection between doctor and patient, if a doctor rushes his patients through, the patients will say, I'm going to go to another doctor. It's my money. I can see whoever I want. And Dr. Waldman, you only spent 14 minutes with me, and I needed more time because I didn't understand what the heck you were talking about. So I'm going to go to another doctor who will spend 30 minutes or 40 minutes or whatever explaining this thing before I have my child operated on. Bottom line is we need to reconnect the doctor and the patient, and that's basically what the book and all these articles that I've written say. And in a sense, it is so simple. Everybody goes, health care is so complex, and I don't understand it, and most people understand it, which is all true. The reason it is so complex is because this cancer of the third-party payer and the government controlling health care has created this massive bureaucracy that takes, ready for this, the bureaucracy of our healthcare system consumes over 40% of all of our healthcare spending. So when you're talking about $3.6 or so trillion on healthcare, now you're talking about $1.4 trillion of care that the American people aren't getting because our federal bureaucracy is taking that money away and paying itself. And as a physician, I look at $1.4 trillion and I go, how much care could we give the American people if that money paid for care instead of rules and regulations and bureaucracy and mandates and actuaries and advisories and all this stuff that the government does? So that's what I'm trying. And most people, when they read the book, Curing the Cancer in U.S. Healthcare, most people will go, oh, okay, that actually makes sense. The trouble is, right now, most people can't even think about the system because they're sitting in their homes shivering in fear of this virus that we really shouldn't be in fear of. And I'm sorry to say our medical leaders in this hospital have created a panic, in this country, have created a panic over another viral epidemic. So far this year, the COVID-19 virus has killed 9,507 Americans, okay? Most of them, by the way, were elderly people who already had heart disease and kidney disease, and I'm not sure whether they died from the virus or they died from their pre-existing condition, but whatever, 9,500 Americans have died so far from the COVID virus. Last year, flu alone, the flu season, took away 61,200 people. 6 times the number of people died from the flu last year than died from the COVID virus so far this year. So I think we have overreacted, and I think we need to reconsider and then reverse our current thing. And I don't think it's going to happen. I don't think that the federal government is going to take the advice that I just gave, because they have created such a fear in our people that I don't think they can politically get away with it. I think our people are terrified of this virus when they weren't terrified of the flu virus last year, but they're terrified of COVID-19.
Well, they don't know, the federal government, especially he who should not be named, does not understand the nature of the beast.
Well,
and
I'm going to argue with you as follows. You're probably right, but I do believe that President Trump is taking his marching orders advice, call it what you will, from the head of the CDC and others who initially, when this virus first broke out, the Imperial College in London put out a model of what they projected would happen when this virus, which is highly contagious, it is, when this virus would get out into the general public. And they were talking about, just in this country, over 2 million deaths. Okay? That should terrify anybody, so any physician, too. So our medical leaders said, oh, my God, we're not talking about something small here. We're talking about 2 million Americans dying. We've got to do something radical to prevent that huge death toll. So they invoked this social distancing and so forth, and they basically told the president and the administration, here's what's going to happen if you don't do what we tell you. And I believe that President Trump went, well, these are the experts. Of course I have to do what they say because I don't want people to die. So he did it. And they're continuing with these. I don't know if you keep up with this.
Oh, I keep up with it.
I mean, they're still talking about 250,000 deaths when we've had 9,500. And I'm going, hey, guys, aren't you looking at your models to say, well, how many people are actually dying from this, number one? And number two, let's put it in perspective. I was saying to you before we got on this interview that, last year, 2018. 2018, 48,000 people in the United States, 48,000 Americans committed suicide.
Yeah.
Okay?
I just think that's
5 times the number of COVID deaths.
Yes, but it's the deaths were not worldwide, and I think that's what really has terrified people. It's not just in this country, but it's all over the world.
Yes, okay, I hear you, and I think what people are not doing the following. Number one, they're not I'm also a pathologist, in case you didn't know that. And so I know how hard it is, even with an autopsy, to be sure the actual cause of death. And my point is, if you look at the ages and the conditions, pre-existing conditions, you will find, especially, as a matter of fact, in Italy, which of course is all over the news because it's been hit probably the hardest, at least percentage-wise, it's hit the hardest. Those are elderly, debilitated patients whose immune systems don't work right, and Lord knows I don't want anybody to die, but it is not inconceivable to me that a lot of the people who are dying, both in Italy or for that matter in this country, first 19 deaths in this country were all in a nursing home. Average age of those first 19 was something like 84 or 86, something like that. And I guarantee you these people had heart disease and kidney disease and chronic lung disease especially, because this is a respiratory virus. And so it's very easy for a virus to invade somebody who has been a smoker for 40 years and has chronic lung disease and, frankly, take that person away and kill that person. That doesn't take much power of the virus. It's a hell of a lot harder to kill a healthy, normal, and we have had a few teenage deaths, but it's much harder to kill a virus, to kill a 13-year-old than it is to an 83-year-old. My whole point is that we suddenly saw these people dying, and dying fairly rapidly, the elders, the debilitated. And so we went a little crazy, we, the world. And so I think we need to now that we've had, 5 months of data since the initial virus got reported from Wuhan, China. We've got 5 months worth of data from South Korea and from Italy and from China itself, although their data is
yes, you got to be careful with them.
Yeah, I mean, we have to take their data, but take their data with a grain of salt, or, since I'm a cardiologist, salt substitute. The fact is, we've gotten data. I'll give you a great example of something we should learn. Italy, at the outset of this epidemic or pandemic, Italy decided that they would do limited testing basically to anybody that was symptomatic, to the very older population, and not widespread testing. South Korea did widespread testing. They did all sorts of charting with, well, if this person's got a virus, I want to look at his movements, who he contacted, so they could do an epidemiologic map, a chart of how this virus spread and where the hot spots would be, past tense, or future tense, would be. So they started their quarantine very early and specifically targeted at the places at highest risk, and as a result, they have, I'm guessing, I don't remember the latest number, but something like 150 deaths or 250 deaths, where Italy has over 5,000. So, and the two countries have similar population numbers. So, I think it's statistically significant that that so many fewer people died in South Korea. My point is that we, the United States, should learn from that experience, and we should be testing everybody.
Yeah, well, that's the problem. I haven't even been tested yet. And I think the thing that really bothers me about the testing is when you're taking the testing, you can prove to be negative now, but that doesn't mean 2 or 3 weeks, if you're still out there among the people, that you're going to remain that way.
Yeah, but the flip side of that, yes, you're right. The flip side of that statement is I don't know, you don't know, no one knows how many Americans had, past tense, this virus in November or December or January,
yes,
never got symptomatic, and are now immune to the darn thing, and they could provide what we call herd immunity, which will suppress the spread of this virus. We need the denominator of all of these ratios, and the denominator is how many people were infected.
And that's an interesting question, because I know for me personally, I keep on getting, nothing serious. I don't have any temperature, but
thank goodness.
I get these sore throats, and I get a little stuffed up, so you don't know whether that's spring.
Yeah, that's more likely to be, God willing for you, more likely to be allergy than it is to be COVID.
Exactly, but most people who would look at those would get hysterical immediately. All I do is start gargling with salt.
Yeah. And so one of the things that would allay the panic that is circulating around our country is if we had, or if we would now, test literally 10 million, 20 million Americans, 50 million, 100 million Americans, and we could then, or the administration could then turn around and say, well, we have, I'm making this up, but you'll see.
I understand. The majority of it would probably be negative.
Confirmed cases, of which 370,000 have developed symptoms, but the other 9,600,000 didn't have anything. Now, I don't know that that's true. Without testing, I can't say how many people had this virus, have it right now, are developing antibodies, and aren't sick. Without testing, we don't know the answer. South Korea knows its answer. We don't know our answer. We don't have the denominator of all of these. How many, what percentage of X? Well, the percentage, the denominator of that ratio is the number of people infected, and they keep talking about confirmed cases, 370,000 or 330,000, I think is the.
But they don't know. And the thing of the matter is, they haven't gone about it in a systemic way in which everyone can be tested. During the 50s, there were no garages who could give your cars inspections. You would go to a certified place, and you and your car would wait several hours, but it was systematic. Everybody in that state would get their car inspected because they had specific days in which they showed up, and they waited, and all the cars were inspected. I lived in New Jersey. They were very good about this type of stuff. Actually, you went to New York to have it done. But the thing was, it was everybody got it. Now it's sporadic.
Yes.
There's no way that everybody is going. I still haven't been tested, and yet we're considered a hot spot. If one person came in, it would wipe out the whole nursing home.
Yes. Now let me. I don't like usually playing the blame game, but occasionally you need to place the blame in order to learn something and do better for the future. So here's a rhetorical question. Why is it that we have had a viral outbreak in 2002, 2009, 2012, 2016, avian flu killed, I forget the number, but and that was the fifth avian flu we had in the last 8 years prior to that. And now we got the big flu of 2017-18 and again 18-19, and now we got COVID. Here's my question. Why the hell don't we have contingency plans? I mean, the military sits there in the Pentagon and says, well, let's play war games. What if, China invades Taiwan? What if there is a nuclear exchange in Kashmir? What if this or that? All these weird, hopefully never to happen military scenarios, potential military scenarios. They say, okay, now what would we do if X happens? So why is it that we keep going, oh, my God, we have a viral epidemic when we have them every 2 years or 3 years. Why don't we have contingency plans? Why don't we have a stockpile of, I'm making it up, but 300
No, I understand what you're saying, and it really makes you wonder. The U.S. is considered the richest country in the world.
We are.
And we are. And yet we're the poorest when it comes to academia. I think we're 23, 24 on the list now. But the point of the matter is that I think we have this attitude, it can't happen to us.
No, you're absolutely.
And because of that attitude, I mean, I hear people say, well, it's not going to happen to me. And I'm looking at them thinking, what planet are you from?
Yeah, just look at history and say.
Just look at history. This is the equivalent, for better or for worse, of the Black Plague during the 12th and 11th century.
No. I mean, come on. The Black Plague killed 300 million.
Yes, I did, and we have enough rats in our cities to do that. But what I'm trying to say is that they had a good excuse for not being able to contain the virus. We don't have that excuse. We have the internet. We have communication. We're advanced in the sciences and in health.
Yeah, but you have to finish that thought. Yes, I'm with you, but you have to finish that thought and say, and not only do we have the wherewithal, but we also have the information to know that it's going to happen again.
Yes, and that's the thing that's more scary to me.
Yep.
And trust me, I'm not scared about the virus. If I get sick and die, well, okay, it's an act of God. But the thing that bothers me is that, yeah, we can contain this. That's great. But guess what, folks? It's going to come back. And if it doesn't come back as this, it's going to come back in something else.
Yes.
But it's going to happen. Don't you guys read the Bible? Yeah. It tells you everything there. And trust me, I'm an atheist.
I was saying to one of my colleagues about 3-4 days ago, I was saying, what if, just for the hell of it, what if the next virus in 2025, for reasons I don't understand, but what if it causes blindness?
Yeah, or deafness.
Yeah, or deafness. You know, in other words, it's not respiratory, which is something we know about, but is it causes you to be unable to see. How would we handle that? Why don't we play a medical war game? And one last thing before I forget. Yes, we should of course play that, but we should also be playing a fiscal medical war game.
And I think that's maybe what we should start doing. Because it seems
why do we suddenly make it up on the fly instead of having our policy planners sit there in peace and quiet when there isn't an epidemic and saying, well, what if we had to shut down, reduce the social distancing, whatever you want to call it, lockdown, extended furloughs to our workforce. What if we had to do that? How would we handle the fiscal consequences of that? Let's play that game for a minute instead of suddenly in the space of 9 days passing a $2 trillion bailout bill that, it's got all this pork in it and all these things that aren't very useful. But my whole point is we should be planning for the future, contingency plans. And what my big fear is that we won't learn from this one because we didn't learn from the last.
We didn't learn from the epidemic and the enduring for the flu back in 1917.
H7N9, avian flu, SARS, MRSA. I mean, I can keep.
We didn't learn
them.
anything from the AIDS epidemic either.
Yep, no question. And I think. And notice I'm not blaming any one administration, any party, because the various parties have been in power in Congress back and forth over the last 40 years. Why the hell don't we have? I mean, there was Trump did away with Obama's pandemic response team, and everybody, or a lot of people, attacked him for that. And I'd turn around and say, yeah, but they didn't do anything. I bet you don't know this, we had a stockpile in 2008, the United States, of over 100 million face masks. Those face masks were used for the H1N1 epidemic or pandemic, whatever you want to call it, in 2009. Very appropriate that we had that stockpile and that it was used quite largely for medical people, but also for our children because the H1N1 attacked our children. Okay, fine. Why didn't they replace the stockpile? Because they didn't.
No, they didn't. They really believed that
they
didn't have to.
Yeah, it won't happen again.
It won't happen again. It won't happen to me. Yep. And that's a very prevalent attitude in our society and our culture.
And sadly, that's going to harm a lot of people.
Absolutely. Deane, we've got to wrap it up.
Yep.
But I will bring you back, so please tell everybody where they can find you and your book and all that great information.
Well, anybody welcome to come to www.deanewaldman.com. My mother put an E on the end of Deane 76 years ago, so I've been paying for that ever since. It's DEANE Waldman, WALDMAN.com. Please check out. There's lots of free stuff there, videos and articles and blogs and so forth that are very helpful and informative and, quite frankly, easy reading. The book is Curing the Cancer in U.S. Healthcare. I really want people to read this because this was not written for the average. This was not written for the politicians or other policy people or other doctors. This was written for the average American. It's very easy read, and the whole point is we can't depend on Washington to fix our healthcare system because Washington is the cancer. We, the American people, need to say, no, this is the system we want, and if 39 million Californians want a single-payer system, my response is, I happen to think that's a mistake, but it's your right, your choice, your liberty, freedom to choose whatever healthcare system you want, and Washington shouldn't dictate to you. And if Texas wants a market-based system, which is what I've been advising for a few years, that should be their choice, just like California can do what it wants, and so forth. My point is we have to return the power of both medical decision-making and money to the individual, not to a third party and not to the federal government. And that's what this book explains, why we should do it, how we can do it, how easy it is to actually get this done. Well, that's not true. How simple it is to actually have a system that will work. The problem is that it's hard because the people in authority will have to give up authority, and they won't give it up freely, which means we have to force them. We, 330 million of us, have to force our leaders to say, no, we don't want you to control our lives. We want to control our lives, and that's my whole thesis.
That sounds terrific.
Oh, they can get the book, Curing the Cancer in U.S. Healthcare, States Care, which takes away the federal government from healthcare. By the way, that doesn't mean that we'll lose, a couple of $1 trillion. We would demand that we get our money back. The money that the feds are currently spending on federal bureaucracy in healthcare, that's our money. Well, we want to spend it on doctors and nurses and drugs and hospitals and wheelchairs and whatever, not on federal bureaucrats. So they can get this book, Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine on Amazon. It's cheap. It's both the print version is less than $20, and the ebook, which I hope people will download because it's you can just do that in your home. You don't have to get a physical product. Is like I think $4.99 or something. It's less than $5. So Anyway, I hope people will read that. I enjoyed talking with you, Lillian. I'm happy to do it again. And God knows I wish everybody good health. And at the moment, stay home and don't pick up your mail.
Yeah, I hadn't thought about that. Well, I don't get that much mail.
I tell you the last thing. I heard this from somebody, I think it was Oz, Dr. Oz, who mentioned that money can hold, money is not paper, it's linen.
Yeah.
And money can hold on to the virus for up to 12 hours, so coins as well as the linen. And I was thinking, how often do some of us, go to a grocery store and, buy milk or bread or whatever, and we exchange money, and the point is what we should be doing is using a credit card and cleaning the credit card every once in a while, but that way we won't transfer the virus by money.
Oh, absolutely. I don't use cash pretty much. I just use credit card. It's a lot easier. It's cheaper. I get money back. Yep. I'm a happy camper.
Yep.
Okay, ladies and gentlemen, adults of all ages, children of all ages, you can listen to this interview with Deane, with an E, Waldman, all over again at https://PassionateWorldTalkRadio.com. Scroll down, menu, find Cool Your Heels, click, and there it is. If you're technologically challenged, there is a sizzle line called the phone line. Punch in the numbers, and you'll hear it immediately. You can also hear it on iHeartRadio, iTunes, Twitter, YouTube, Facebook, Alexa, Spotify, Podcaster, Podchaser, all over the internet. You can find it. And before you go away and stray, Lichtenberg had this to say in 1764, "Nothing is more conducive to peace of mind than not having any opinion at all." Thank you all very much for listening, and remember, until next time, stay healthy.